Okay, so today I want to talk to you a little bit about stenosis. So I've had a lot of patients coming in lately that have been diagnosed with stenosis, but didn't really understand what it was other than their spine was twisted or contorted or something like that. Well, even when you look up stenosis, the Mayo Clinic says stenosis, the cause of stenosis is age. Well, the funny thing is I've had patients as young as early 20s come in that were diagnosed with stenosis, and I've had people in their 60s, 70s, 80s diagnosed with stenosis, and actually I've had plenty of people in their 80s and 90s that had no stenosis. So if it was really an age thing, then you would think that, well, at a certain age, pretty much everybody would have it. Otherwise, why do some have it and some not? Well, let me explain to you exactly what stenosis is. So stenosis means the closing down of an opening, okay? And in your spine, you have these vertebrae that are all stacked up on top of each other, and through them comes the spinal cord. Well, if one of the bones gets a little bit turned or a little bit moved or a little bent in one direction, it closes down on that opening. That is stenosis. Okay, now from a medical standpoint, there's not a lot they can do, right? There's no drugs that are going to realign those bones. There's no surgeries, well, I guess, they could do, but it'd be pretty tough surgery, and actually they have tried to do that on some people. But the odds aren't real good that they're actually going to go in and surgically realign those bones. If they do, you're going to have a lot of, bolts and screws and stuff like that in there that I wouldn't recommend. So what we do as upper cervical doctors is these bones have moved for a reason, okay? They're compensating for something going on in your spine. How does that work? Well, it all starts at the top. Believe it or not, it's all about where that head is. In our saying, we ask people all the time jokingly, is your head on straight? Why? Because if your head's not on straight, your body's going to compensate till it gets straight. How does that work? Well, so at the very top, your head sits on one of these top two bones called the atlas and the axis. If one of those bones, due to some sort of a fall, a car accident, sports injury, some minor trauma, maybe even years ago, can take the head a little bit out of balance, well, their brain doesn't like it. So what does your body do to get the brain balanced? Well, the brain sends messages now forcing your body to compensate. How does it do that? Well, it might pull down one shoulder, it might pull up one hip. Well, to imagine if your head's straight now, but your shoulders dropped and your hips pulled up, what's your spine doing? Okay, it has to kind of bend and turn a little bit, right? Which means those bones are bending and turning a little bit, which is causing stenosis. Now, if it's a minor stenosis, you have no symptoms. If it's a severe stenosis, well, it could actually force the disc to start to bulge to where it can affect the nerves that go down the arm or down the leg. It can create numbness, tingling, okay? It can create muscle spasms, neck pain, back pain, leg pain, okay? All from something going on at the top of your neck. So if you go to your medical doctor, he's probably going to say, well, take these pain pills, okay? Is that going to fix the stenosis? Absolutely not. So maybe you go for physical therapy. Is physical therapy going to fix the stenosis? No, because physical therapy is going to be working mostly with muscles. So the only way to really fix the cause of stenosis is to go to the source of where it all originated, and that's up here at the top of the neck. So what you need to do is you need to find an upper cervical doctor near you. If you're in the Charlotte area, give our office a call. We'll be happy to check you. We never charge for a consultation. You come in and we'll find out that if it's something we think we can help you with, then we'll let you know. If it doesn't, it doesn't cost you anything. But if it does, if it is something we think we can help you with, then we'll make recommendations on what we think we need to do in order to try to help you with your stenosis. Don't live another day with this stenosis and the pain that goes along with it. Give us a call. Let's see what we can do to try to help you.